The autonomic nervous system.
Don't sound so excited. Okay. When I was talking with Mary, I said, hey, you're going to be all caught up. Chapter 9 is a real short chapter. It's only like 18 pages.
Yeah, and half of them are drawings.
But there's a lot of information on these 18 pages. But again, a lot of what we're going to see here, Rudy.
He wants you to come up and explain what an oxidizing.
I tell you what, I'll make it true and false next time.
50-50.
Yeah, never mind. I looked at true and false, and I said, you either got to know it or not with a true and false. They're not easy.
This was not a general question. This was not a general test. This was very specific. You wanted really very specific, detailed information on this, and it was very confused wording.
It was right out of the book.
I read the book twice.
It was right out of the book. Okay, involuntary effectors. The autonomic nervous system. Auto, self, involuntary. So you're looking at the nervous system that controls parts of the body that consciously you cannot control. Kidney function, respiratory to a certain extent, cardiac, various parts of the body that you simply cannot control. What's that? Digestion. Yeah. Yeah. The peristalsis of the bowel. You cannot consciously control that. So, that's your autonomic system. Here are some of the nerves.
Yeah, it's in the supplement.
It's page 73.
73 should go before 58. Yeah.
73 should go before 58.
Yeah, you know what I mean? Yeah.
My supplement's so screwed up, I don't even use it. Okay. It's the reduction page. So, up here, midbrain, hindbrain, you have your cranial nerves. Ciliary muscle of the eye, lacrimal gland, mucosa. These are cranial nerves. They're autonomic. You shine a light in the eye, you can't keep the pupil open. It's gonna shut. It's gonna move. You have sympathetic ganglions coming off your spinal column. You have more. Now I'm going to talk about two types. You have sympathetic and you have parasympathetic. So we will get into that. But here you have parasympathetic down here, or coming off your coccyx. And this is your spinal column. I just put new batteries in this thing too. I think you probably ought to quit, don't you think? My laser isn't. Okay. This is your spinal column. Thoracic down to lumbar. Sacral. You've got the nerves coming off. Pelvic nerves going to the reproduction organs, the bladder, the lower part of the large intestine. And we're going to get into these things, but this is, these are your involuntary effectors. You have the adrenal gland on the top of the kidney. Adrenal, adrenal, on the top of the kidney. That's where you get your adrenals. large intestine, small intestine, stomach, pancreas, liver, gallbladder, heart. These are all controlled by autonomic nerves. The lung, the breathing, the parotid glands, the salivary glands, nasal mucosa, the ciliary muscle of the eye. You can't control them. They're all part of that. Alicia, did you say you had 2 AAA members?
Yeah.
Can I borrow them?
Yeah.
I'm sorry.
Hey, for how much? For how much?
It's your
How much?
Oh, sure.
Oh,
Thank you.
And you're my favorite teacher too.
Wait,
Yeah.
what brand is it? Mine's Duracell.
You're my favorite teacher of all the classes that I've taken.
Stronger.
How many people think that you're my favorite teacher, Rachel?
Hang on, I may not need them.
It's the thought that counts though, remember?
Okay, going on. Autonomic motor nerves, the innervated organs not under voluntary control. Effector is the organ. Muscle, smooth muscle of the visceral organs. Blood vessels, glands. Somatic motor neurons. Somatic is not autonomic. Somatic goes to your skeletal muscle. Generally 1 neuron. You can control it. Somatic nerves you can control. Autonomic you cannot. Autonomic, somatic has a single neuron, goes down cell bodies in the spinal cord, and then traveling from the spinal cord to the effector. The effector is the muscle. Or the, well, generally just muscle. That's about all you can control. Autonomic has 2 sets of neurons in the peripheral nervous system. It goes from the spinal, down the spinal, it goes out of the spine, it goes to a ganglion, it goes from the ganglion to another nerve, that nerve goes off to the effector organ. You'll see that. First cell have bodied in the brain or spinal fluid. This is your autonomic. First has cell bodies in the brain or the spinal cord. Its synapses in an autonomic ganglion, and they run up and down the sides of the spinal cord. Second has cell bodies in the ganglion. Its synapses there, it goes off to the effector. The effector again is the organ that, or gland or whatever it's dealing with. So you have 2 types of neurons in the autonomic. You have preganglionic and postganglionic. The pre is the one that comes out of the brain or the spinal cord, goes out through the dorsal root, and then joins by synapse to the postganglionic. The postganglionic neuron goes from the ganglion to the effector organ. Pre and post, down here. Your CNS. You need them yet. Those were brand new.
Remember those old-fashioned sticks, like when I was in school with the rubber stick?
Yeah.
I think they also do.
At least it's not that was
Yeah. I got beat by our teacher, so
I got slapped more than once by one of those things.
We got the nice little roller with the metal in it.
Still not working. Okay. So here, preganglionic, CNS down to the ganglion, postganglionic down to the effector, down to the muscle. Suppose I probably can't even forward this thing. No, that part works. Okay, the autonomic ganglia, located in the head, neck, abdomen, depending on where they're coming out. The ganglion for the eye, it's located by the eye, out by the optic chiasm, outside of the brain. And then it works in chains along either side of the spinal cord. Visceral effector organs, independent. Now, if you get somebody that's got a spinal cord injury and the somatic nerves are cut. The muscles, the skeletal muscles, become flaccid. They degenerate. That doesn't happen with the autonomic. The autonomic organs tend to maintain themselves even without the neurons, and sometimes they even become hyper polarized, so they react even more, not efficiently, but they're more sensitive to various stimulations. They're somewhat independent of the innervation, will not atrophy if a nerve is cut, like the skeletal. Cardiac muscle, smooth muscle, contract rhythmically without nerve stimulation. If you lost your AV node or your SA node in the heart, and we'll get into that when we look at the heart, the node that sends the pulse through the heart, the pacemaker in the heart. If you lost that, your heart would still beat at between 20 and 30 beats per minute without that electrical input. This is part of your autonomic system. Of course, unless you're laying down on oxygen, you're not going to live with a heartbeat, or very long with a heartbeat of 20 per minute. That's where we go back in and we put a pacemaker in. Autonomic innervation can speed or slow down intrinsic contractions. Somatic neurons, unlike somatic neurons are always stimulatory. You're always telling some muscle to move. You're stimulating it. Autonomic can be stimulatory or inhibitory. We have two systems. Let's see. This is in the book. Effector organ, skeletal muscle, you've got cardiac, somatic motor. Effector organ, somatic motor, autonomic. Somatic, you've got skeletal muscle. Autonomic, you have cardiac, smooth muscle glands. Ganglia, you have no ganglia in your somatic motor neurons, you do in your autonomic. Number of neurons from CNS to effector, 1, 2. 2 in the autonomic. Preganglionic, postganglionic. It gets to the effector, it has a motor end plate, the neuromuscular junction. We talked about that in Chapter 7. No specialized postsynaptic membrane, and we'll look at that. Some smooth muscle cells contain receptor proteins for neurotransmitters. Your heart has that. Effective nerve impulse on the muscle. It's only excitatory. In your autonomic, you can have excitatory, which starts the depolarization process, or inhibitory, which hyperpolarizes, depending on what's being transmitted. Type of nerve fibers, thick, myelinated. Nodes, they jump. Slow conducting. Autonomic's much slower. Effective denervation. Flaccid paralysis, atrophy. Generally, you'll maintain muscle tone in the autonomic. This, again, is in your book. Divisions of the autonomic nervous system. Sympathetic. You have two divisions. You've got sympathetic and you have parasympathetic. Have you ever heard of the flight or fight syndrome? That's your sympathetic motor neurons. Your parasympathetic is not quite as common, but it might be rest and recuperate, rest and repose, rest and digest, something like that. Your sympathetic is the one that kicks in when somebody throws that firecracker, and you're awake and your eyes open up, your blood goes to the skeletal muscles, you're ready to run, fight. Your parasympathetic is what kicks in when you relax. It allows the digestion to begin again. We'll get into it, but it allows digestion, it allows the blood back into the periphery, any number of things. Rest, more resting. Sympathetic. Preganglionic neurons come from the thoracic and lumbar regions of the spinal cord. Sympathetic. T1 through L2. Thoracic down to lumbar. There's your sympathetic. They're called thoracolumnar. They synapse in the sympathetic ganglia that run parallel to the spinal cord. We will see those in a minute. They're called paravertebral ganglia. They run up and down the spinal cord. They're connected, forming a sympathetic chain of ganglia. When the nerve comes out of the spinal cord, it connects to the ganglia, but then the ganglia all connect to each other also. So you can, when your sympathetic system kicks in, everything kicks in. Your heart rate goes up, your breathing, your blood shifts, everything goes in at one time because of these connections. When one fires, they all fire, pretty much. Sometimes your heart can be fired, for the most part. Your heart's a little bit different. So, sympathetic, preganglionic. Preganglionic, from the spinal cord to the ganglion, from the nerve down to the ganglion. The vertebral roots, they diverge into the white rami. The white rami are here. The white rami are what help connect all these ganglion together. So you have the spinal cord, sympathetic ganglion. These bulbs are the sympathetic ganglion. This is your vertebral body. This is your spinal column. Posterodorsal root, depending on the nerve as to where it comes out. The rami, that's your white rami. This is what communicates from the spinal nerve, which is coming out, back to the ganglion. The ganglion's all hooked together. The system is all intertwined. So when one fires, they all fire. Sympathetic promotes fight or flight response, corresponds with arousal, energy generation. It diverts blood away from the GI tract. If you're running for your life, you need that blood to the skeletal muscles, not digesting, your sandwich. If you're running for your life, you don't need blood going to the kidney. What it does is it has muscles, and it just clamps down. It closes off the capillaries. Kidney can go for 4 or 5 hours or more without a blood supply. I mean, they do that when they transplant kidneys. They'll pull one out, they'll put it on ice, and they'll fly it across country. Blood flow to the skeletal muscles and lungs is enhanced. You want the blood where it's going to do you the most good. You've got to be able to run or fight, and you need it in the muscles. You can't have lactic acid building up and getting, stop running because of a cramp. Blood flow to the skeletal muscles enhanced by as much as 1,200%. Dilates bronchioles in the lungs for more breathing, more oxygen exchange. Increases the heart rate, not only does it beat faster, it beats harder, and more, which also pushes more blood out. Dilates the pupils. You want all the light coming into the eye. You want to be able to see what's going on, especially in the dark. Dilates the pupils. More light entering the eye and vision. Provides vasodilation, more blood to the coronary vessels of the heart. The heart's working harder, it needs the oxygen coming back to its own muscle. Constricts all the intestinal sphincters and the urinary sphincter, which sometimes doesn't work.
Sometimes it's the exact opposite.
Yeah, well, I have a puppy that it really doesn't work. Inhibits peristalsis. Not that this is part of the fight or flight, but it does. The sympathetic system is the part of the system that does stimulate an orgasm both in the male and the female. And the peristalsis again with diabetes, it will help with the peristalsis. The peristalsis is the contraction and the moving of stuff down the intestine. Convergence and divergence. We've talked about this before. Divergence is one preganglionic neuron synapses with many postganglionic. It's coming down, it's like a tree upside down. Coming down, diverges out. Convergence. If you have several preganglionic neurons at different levels, synapse with one postganglionic neuron. It allows a sympathetic division to act as a single unit through mass action. Either you're going to have several impulses coming down to one organ, which happens, or you're having a lot, or you're having one impulse coming down and going to several organs. Sympathetic postganglionic neurons, they're unmyelinated. They form the gray rami, communications which return to the spinal nerve and the spinal neurons to their effectors. Unmyelinated axons. They're slower. Of the postganglionic neurons form the gray rami. Gray rami communicates is what it's called. And they return to the spinal nerve and travel with other spinal neurons to the effector. Sympathetic chain, called the paravertebral ganglia. Remember, they went right up and down their vertebral column on each side. They were located on the ventral and lateral part of the spinal cord. The chain extends from the upper neck down to the coccyx, from the tailbone to the back of the neck. So you have the unpaired coccygeal ganglion is the bottom one. Preganglionic nerves from the spinal cord synapse have one of the chain ganglia, and the postganglionic fiber extends to the effector. So like I said, it comes down, it comes out of the spinal cord, it goes to the ganglion. Not in all cases, there are a few that don't, and we'll get to that. And then it goes from the ganglion out to the effector organ. But in the sympathetic, the idea is the body is able to fire all these ganglions at the same time. And it does that. They're all hooked together. 21 to 23 pairs of ganglia, 3 in the cervical, 12 in the thoracic, 4 in the lumbar, 4 sacral, and 1 unpaired in the coccyx, called the ganglion empire. Collateral ganglia. Many of the nerves exit the spinal cord below the diaphragm. They don't synapse in the sympathetic chain of ganglia. Instead, they form a splanchnic nerve which synapses in the collateral ganglia, and there's a different ganglia. They're not the vertebral, the celiac, superior mesenteric, inferior mesenteric. We'll see a thing on those in a minute. Postganglionic neurons innervate organs of the digestive, urinary, reproductive system. So they come to the collateral ganglia, either the celiac, superior mesenteric, or inferior mesenteric, and from there they go on to the organs of the digestive, urinary.
So is that where the disease celiac sprue is kind of associated with?
Sprue is more of an allergic reaction in the gut. You have different types of...
Because celiac sprue is a particular...
Well, celiac is the celiac, that's just a location in the gut.
So, because the disease is called celiac sprue, and
Yeah.
it's when it's an extreme, it's
But
basically like gluten is like poison.
Yeah, but
So
that's not, it's not a neural disease. It's an allergic disease. But
it's not associated at all, it just happens to be...
in the cilia, part of the intestine.
Oh.
That's why it's called celiac sprue.
Well, it's spelled the same way, so
Yeah, but we're talking about ganglia. We're not talking about intestinal parts. These are part of the celiac nerve parts. not part of the intestinal system or the digestive system.
Yeah.
Neurons of the collateral ganglia, prevertebral, they can be called prevertebral. They cut the input from the splanchnic nerve. The splanchnic nerves come out, they leave the spinal column, they do not go into the vertebral ganglia. They miss them, they go by them, and they go to the collateral ganglia. Innervate organs in the abdominal and pelvic region, and we just talked about this. Celiac ganglia, superior mesenteric, inferior mesenteric ganglia. Okay, sympathetic neural pathways. Here's your spinal cord. Coming out of the spinal cord, going out to the visceral, the effector. It may come down through the gray ramus and go back out to the effector through a different ganglion. You have your white ramus connecting the different ganglions again. Sympathetic chain ganglion, it's also heading up, it's coming out of here, it's going up and down these chains of ganglion. And here's your splanchnic nerve coming out and going over to, this is one of your collateral ganglia. So there's a lot of impulses going out to the effector organs. Fight or flight. You want the stimulus there. Postganglionic, preganglionic axon synapse with postganglionic neurons. Postganglionic axons innervate the target organs. So your dotted ones, here's your ganglion coming out of here. Postganglionic is dashed. Preganglionic is solid. Collateral ganglion. Superior mesenteric is up here. Pelvic sympathetic. Inferior mesenteric is down there. Your celiac is up there also. So you've got, here it shows both collateral and some of the regular sympathetic ganglions along the spinal cord there. Adrenal glands. Adrenal, on top of the kidneys. That's where your adrenals are. You have two parts. You have the cortex and you have the medulla. The medulla secretes epinephrine, and then sometimes a little norepinephrine, and it's part of the sympathetic nervous system. The cortex is different. It secretes steroids. Embryologically, the adrenal medulla is modified ganglion, innervated directly by the preganglionic sympathetic neurons. Okay, that's the medulla. The cortex is not. Okay, sympathetic. You have the eyes, coming with the cervical ganglia. Head and neck, cervical ganglia. Heart and lungs, upper thoracic ganglia, T1 to T5. These are your vertebrae. This is where they come out. Lower extremities, adrenal is T10 and T11. There's no postganglionic fibers. Celiac, some of them come out with a splanchnic nerve and going to the collateral ganglia. Celiac, the celiac there. Interior celiac, interior mesenteric. Upper, that's not, these are collateral, excuse me, they're coming out with a splanchnic nerve, going directly to it. And they generally do with the lower, the urinary tract, reproductive tract.
Are you going to have us to know what all the T1 to T9?
I think that's a fair question.
Well,
You have 31 pairs of spinal nerves, and
This is a fair question.
Well, I don't know. I thought the last test was pretty specific, so. I don't know.
Not even.
Yes or no?
No, I'm not going to make you memorize what comes off of every thoracic or lumbar or sacral vertebrae. I'm not going to make it an anatomy class. And if there is something that I want you to know, I will certainly let you know that. Okay? Parasympathetic, rest and relaxation. Preganglionic neurons come from the brain or sacral region of the spinal cord, cranial sacral. So they're coming out of the brain or they're coming out of the lower part of the spinal cord. Your sympathetic are the ones that come out of the middle of the spinal cord. The synapse on ganglia located near or in the effector organs. They don't have the vertebral ganglia running up or the collateral ganglia. They have terminal ganglia that are in the organs. The vagus nerve, when we get to that, the 10th cranial nerve. That's one you probably ought to know, because that's a biggie. So everybody write that down. The vagus nerve, the big circle, the next exclamation point, 10th cranial nerve. Almost guaranteed that'll be on one of the tests.
That's the one you stimulate when they have like a heart.
When you do a brachial rub in that, they stimulate because it slows the heart rate. Preganglionic neurons do not travel with the somatic neurons. Sympathetic do. You'll have sympathetic neurons and somatic neurons traveling in the same bundle. A lot of the preganglionic neurons don't even go down the spinal column. Effectors in the skin, skeletal muscles, sweat glands, blood vessels. Your parasympathetic, if your sympathetic is closing down the blood vessels to push all the blood back to the skeletal muscle and to the heart and to the lungs, what does your parasympathetic do? Opens them up. Lets it rest. Lets those cells get the nutrition they need. Lets your body start to digest, absorb more nutrients. Rest and repose, rest and relaxation, rest and whatever the R is for feeding. Promotes rest and digest. Calming of the nerves, return to regular function. Dilates blood vessels to the GI tract, increasing the blood flow. You can absorb more nutrients. Rest and repast. That's, repast is to eat. Leisurely eating, I believe. Constricts bronchial diameter when the need for the oxygen is diminished. It has dedicated cardiac branches, the vagus nerve, and thoracic spinal accessory nerves impart control, parasympathetic control to the myocardium and the heart or myocardium. So that's the parasympathetic that causes your heart to slow down, causes it to come back into a normal 60, 70 beats a minute. Accommodation, the parasympathetic system is the one that causes the pupil to contract, closing it down, not as much light. And I think, are we doing vision Thursday? We're doing one sensory. I think it's vision, which is really kind of fun. Stimulates the salivary secretion, accelerates peristalsis, so that you can move the food through. And when we get into reproduction, the parasympathetic works along with the sympathetic. In the male, the parasympathetic allows the blood vessel to the penis, but to get the erection, it allows the clitoris to enlarge, and then it's the sympathetic that allows the orgasm. It's called collateral or complementary stimulus.
We're doing digestive enzyme activity.
What's that?
Digestive enzyme activity.
No, we're not.
That's last. Oh, we're not doing last.
We're not doing
We're doing last.
digestive. Okay, cranial nerves. Cranial nerves come off, come out of the brain. They don't go into the spinal cord. You have some cranial that are parasympathetic, ocular motor, facial, glossopharyngeal, and you're going to swallow. If you get stuff, you can't help it. Vagus nerves carries parasympathetic ganglionic neurons. We're going to talk quite a bit about the vagus nerve. Ocular motor, preganglionic fibers exist in the it's getting to be that time. Exist in the midbrain and synapse in the ciliary ganglion. We'll get into that. Postganglionic fibers innervate the ciliary muscle of the eye. So your ocular motor, your eye muscles are, the sympathetic opens them up. Lets all the light in, lets you see far, lets you see what you can see the best you can. The parasympathetic closes it down.
Reflex. Are we doing?
What's 5?
We already did 5.
We'll look. Facial nerves. Pteropalatal ganglion is postganglionic on the nasal mucosa. Pharynx, palate, lacrimal glands. Submandibular, postganglionic fibers on the salivary gland. Glossopharyngeal on the otic gland. And we'll get into what these do. Vagus. Preganglionic fibers exit the medulla oblongata. Branch into several plexi and nerves and travel to ganglia in the effector organs. The vagus by definition, wanderer. The nerve goes down, it hits the heart, lungs, esophagus, stomach, pancreas, liver, intestine. It's all one nerve. It cuts off acid production. It is parasympathetic in the intestines. It allows the intestines to get blood. It allows the intestines to start digestion. It slows the heart down. Starts the stomach churning, working, moving food through. Cranial nerves. Here's your vagus. Superior mesenteric comes down here. There's your liver, stomach. Vagus comes down. Goes all the way through. Comes all the way down through here. Hits all these different areas. The wandering. Sacral nerves. Sacral nerves come down off the sacrum, the lower end of the spinal cord. They innervate the lower part of the large intestine, the rectum, the urinary and reproductive organs. Terminal ganglia are located within the organs. The sacral nerve comes off. It is not pre- or postsynaptic or postganglion. The ganglions are right in the organs. Summary of parasympathetic. Ocular motor. Preganglionic is midbrain. Ciliary. Ocular motor is the eye, smooth muscle of the iris and ciliary body. Facial. From the pons, it goes the effector or the lacrimal, mucous, salivary glands. Glossopharyngeal. From the medulla oblongata, parotid gland. Vagus. Medulla oblongata, heart, lungs, intestinal tract, liver, pancreas. It goes all over. Pelvic spinal, S2 to S4. Those are the sacral. Lower half of the large intestine, rectum, urinary bladder, and reproductive organs. These are all parasympathetic. Yeah. When they get these, the nerves that come to these, relax them, let them get back to normal. So here, the blue is your parasympathetic, the reds are your sympathetic. A lot of these organs are innervated by both. One of them turns them on, one of them turns them off. And sometimes the sympathetic turns them off. The parasympathetic comes back and turns them on. Cuts off blood flow. Fight or flight gets the nutrients where they need to be to survive, and then after the emergency's over, parasympathetic lets it return back to normal. Functions. Sympathetic, fight or flight, like we talked. They release norepinephrine from the postganglionic neurons and secretion of epinephrine from the adrenal medulla. This is the big jolt you get when the firecracker goes off or the smoke alarm goes off. That's the epinephrine. Prepares the body for intense physical activity, emergencies, increases the heart rate, blood glucose goes up, blood's diverted to the skeletal muscles, blood's bronchi open up in the lung, you can breathe, you can oxygenate better, you're ready to go, you're ready to fight. 4 point. Parasympathetic. It's antagonistic for the most part to the sympathetic. Rest and digest. You release acetylcholine from postganglionic. So you're releasing acetylcholine, not epinephrine. Slows the heart rate, dilates blood vessels, increases digestive activities. You can look at this. I'm not going to go through each one. This is in the book. What is affected by the sympathetic and parasympathetic. Cholinergic synaptic transmission. What does cholinergic mean? It's acetylcholine mediated. The neurotransmitter is acetylcholine. All preganglionic neurons use acetylcholine. And most of the parasympathetic postganglionic neurons use acetylcholine. The sympathetic postganglionic use epinephrine or norepinephrine. There's a few sweat, some of the blood vessels, the nerves that would contract the muscles around the capillaries and cut blood off. Those would use acetylcholine. They're cholinergic. They use acetylcholine. Adrenergic. Norepinephrine is a neurotransmitter. Most sympathetic and postganglionic neurons. They're called adrenergic. Epinephrines are hormonal. This just shows you the formation of it. Okay, they're all made out of tyrosine, dopamine, norepinephrine. Remember dopamine out of the nigra, striatal nigra area for the Parkinson's. This is the neurotransmitter that's messed up. It's not there. Norepinephrine, epinephrine. Epinephrine just has a methyl group added to it. Neurotransmitters in the autonomic nervous system. Here it just shows you everything's got the acetylcholine, preganglionic, visceral effector organs. Some have the, this is parasympathetic. These are norepinephrine from the sympathetic there. The blue is parasympathetic, and it's using acetylcholine. The sympathetic is using epinephrine or norepinephrine. Erythrocytes, axons of the postganglionic neurons, have various swellings that release neurotransmitter along the length of the axon. So along the axon, they've got the swelling. So when it's depolarizing, it'll release, instead of waiting until it gets down to the synapse to release a neurotransmitter, these allow it to release all along. So you get, again, more of the overall. When it fires, everything fires. And this is much quicker. You're not waiting for it to go down to the synapse and come back. They form synapse in passing. Sympathetic and parasympathetic neurons, as we looked at earlier, they innervate the same tissues. One turns them on, one turns them off. Here's one of your bulbs. It comes down. You go over here. You have your parasympathetic here. It's antagonistic to what the sympathetic is doing. The acetylcholine, depending on the receptors, cholinergic receptors or adrenergic receptors. Some are excitatory, some are inhibitory. And it doesn't necessarily mean that the sympathetic is excitatory. Sometimes the sympathetic is inhibitory. Okay, response to androgenic stimulation. That's your epinephrine or norepinephrine. Stimulate or inhibit depending on the receptors. Stimulation, the heart beats faster. Dilates the muscle of the iris. It opens up the eyes. Smooth muscles of some blood vessels causes vessel constriction. That cuts off the blood where it isn't needed and sends it back to the skeletal muscles, the heart, and the lungs. Bronchioles in the lung, other blood vessel, inhibits contraction, causes dilation. It opens up the blood to the bronchioles. It opens up other blood vessels. Again, you can increase the blood flow to some skeletal muscles by up to 1,200%. That's all part of the androgenic stimulation. Androgenic as opposed to cholinergic. Androgenic is from epinephrine or norepinephrine. Yeah. It's about 15% of the norepinephrine. Not acetylcholine. Okay, now, you will see in some organs that they will get the same neurotransmitter and do different things. Some will be excitatory, some will be inhibitory. And what they found is there's two types of androgenic receptors, alpha and beta, and those are broken down into alpha 1 and alpha 2. They all act using G proteins. Now, we've talked about G proteins a couple of times. The protein comes down, it's excited, it's through the synapse, through the neurotransmitter, it releases an alpha, beta, or gamma unit, which goes over and then allows depolarization of the neuron. The beta receptors use a cyclic AMP. The alpha receptors use a calcium as a second messenger. Okay, now this is what you're looking. You're looking at your alpha and beta androgenic receptors. So they're getting epinephrine, either epinephrine or norepinephrine. The eye, contraction of radial fibers, it's stimulatory, it opens the eye, it's an alpha receptor. The heart rate increases contraction strength, it's a beta receptor. Skin and visceral vessels, they constrict. It wants the blood going to the muscles. It's an alpha receptor. Skeletal muscles, the arterioles constrict. Sympathetic, it's an alpha. Parasympathetic, the arterioles dilate if they get it from the beta receptors. Lungs, airways dilate, it's a beta. Stomach and in the stomach and intestine, contraction of the sphincters slows the passage of food. It's an alpha. These are all liver glycogenolysis, secretion of glucose. It's both alpha and beta. The one neurotransmitter is hitting all these. It's epinephrine. And you're getting all the different types of responses due to the type of receptors on the organs. Alpha, 2 receptors located on the presynaptic axons. Presynaptic. When stimulated, the result of inhibition of norepinephrine released in the synapse. Maybe a negative feedback system. Some drugs to lower blood pressure act on these alpha receptors, inhibit presynaptic neurons in the brain, inhibiting the whole sympathetic nervous system. I'm not sure what drugs that is. I'm more used to seeing beta blockers and that in the heart. Response to cholinergic stimulation. Cholinergic, acetylcholine. It's released from the preganglionic neurons for both sympathetic and parasympathetic. It's stimulatory. Acetylcholine from the postganglionic neurons of the parasympathetic can be stimulatory or inhibitory depending on the receptors. If it's stimulatory, it is going to be opening up those capillaries that the sympathetic system is closed down. It's going to be stimulating the digestion that the sympathetic system is closed down. Or it's going to be slowing down, it's going to be inhibitory on the heart, which the sympathetic system has speeded up. So this is coming out of your parasympathetic division. Cholinergic receptors. Found on the autonomic ganglia, you have nicotinic. Now remember, these are named by substances, named 4 substances that we found that will mimic the neurotransmitter. Nicotine mimics it. Muscarinic is found from the mushroom, and it stimulates different neuroreceptors. And now they found 5 different types of muscarinic for opening potassium or calcium channels. If it opens potassium or calcium, it's going to be what? It's going to be inhibitory. Because if your membrane potential is a -70 and you've got a lot of these positive potassium in there, if it opens the channels and they come out, because your intracellular potassium is a lot higher, that's going to be inhibitory. Your extracellular calcium, however, is higher. That would be excitatory. Remember the question on the test? The biggest intercellular cation is potassium. Sodium on the outside, but these deal with calcium. When we do a blood test, that's why we have to get the plasma or serum off the cells, because your calcium will go down, it'll go into the cells, and your potassium will come out. And somebody that could be normal will look very, very sick. Okay, acetylcholine receptors. Nicotinic is on skeletal muscle, opens cation channels. Nicotinic is on the autonomic ganglia, depolarization, activation. Muscarinic, smooth muscles, again, depolarization. On the heart, muscarinic, however, are slowing down the heart rate. It's hyperpolarization. Depolarization opens the calcium channels. Calcium comes in, it moves it from that minus 70 up toward about a minus 55, where your action potential can take place. On the heart, muscarinic M2 hyperpolarizes. It activates the G protein, coupled with a receptor, it opens the potassium channels. It lets the potassium out of the axon. That hyperpolarizes it, makes it much harder for the nerve impulse or the depolarization. This, I think we've gone through. Depolarization, hyperpolarization. You guys need to look at that again. I think we've been through it about 700 times in the last 3 weeks. Summary of receptor activity. Parasympathetic, acetylcholine. Everything has acetylcholine up here. Your sympathetic uses an epinephrine for the most part. Your acetylcholine stimulates muscarinic receptors. Your epinephrine stimulates the androgenic receptors. Okay, so now you have a couple others. They're called non-androgenic, non-cholinergic. Some are ATP, some are the peptides, kind of like you would see in the brain, and the nitric oxide. Nitric oxide is important for the erection of the penis. Parasympathetic neurons innervate blood vessels, causing the relaxation. Can also produce smooth muscle in the stomach, intestines. Relaxes, lets the food go down. Dual innervation. Most of them have dual innervation. And like we said, they're antagonists. You have the sympathetic, speeding the heart rate up, getting ready to fight or run. You have the parasympathetic through the vagal nerve, slowing it down. Sympathetic is depolarizing, making it easier for the reaction. Parasympathetic in that case is hyperpolarizing, making it harder. Digestive functions, parasympathetic allows digestion to begin again. Sympathetic cuts down the blood supply to the intestine because it wants the blood for the heart, lungs, and skeletal muscle. Pupil diameter. Sympathetic opens them up, parasympathetic shuts them down. Antagonistic reactions. Both are, the organs are innervated by both systems. Cooperative effects. Okay, we can get into chapter 10 here. We're almost done here. Cooperative effects occur when both divisions produce different effects to work together. I think we talked about this, erection and ejaculation. Erection and orgasm in the woman. Parasympathetic causes the vasodilation, the nitrous oxide. Not the nitrous oxide, nitric oxide. Nitrous oxide is the laughing gas, and that doesn't help. And the sympathetic causes the orgasm or ejaculation. Urination, the parasympathetic aids in the contraction and the sympathetic helps to control muscle tone. Complementary. Sometimes they produce similar effects on the same organ. Salivary gland secretion. Parasympathetic stimulates the secretion of a watery saliva. Sympathetic works with it to make it thicker. Cuts down the blood flow. So this is complementary. Some organs do not have dual innervation. Sympathetic, the adrenal medulla, that's what's telling you to secrete the epinephrine. Erector pili muscles of the skin, and I'm not sure why they're sympathetic, but that's where the hair, you get frightened, the hair on the back of your neck stands up. That's your erector pili muscles. Sweat glands in the skin, most blood vessels. These are regulated, if they're only innervated by one, then they're regulated by the amount of stimulus coming, as opposed to having antagonistic stimuli. Regulated by increase or decrease in sympathetic nerve activity, the frequency of the depolarization. Control of the ANS by the brain. Autonomic nervous system by the brain. The functions are regulated by autonomic reflexes. Sensory input goes to the brain center. For instance, the neurons, posture, pressure, touch, stretch, they're going to go up and they're going to activate sensory areas in the brain and the hypothalamus and hippocampus, a lot of it in the hypothalamus, and the medulla oblongata. And then the reflexes are going to come right back, and the regulation, the negative feedback is going to take place. We talked about the medulla oblongata, controls many of the cardiovascular, pulmonary, urinary, reproductive, digestive functions from the autonomic nervous system. So it's going to be sympathetic and parasympathetic. Regulation of the medulla, the cerebrum, hypothalamus. The limbic system is responsible for autonomic responses during emotional states, the blushing, fainting, sweating, racing heart. When you're in love. Yeah. Yeah. Butterfly stomach. Autonomic reflexes. Lungs, you have stretch receptors. You have J receptors simulating congestion. Causes the reflex to fall in cardiac rate and blood pressure. Stretch receptors. Further inhalation is inhibited. You've already stretched them. Increase in cardiac rate, vasodilation. You're getting some of the fluid away from the lungs. Aorta is chemoreceptors. Raise in CO2, fall in O2. Goes back and increases your breathing, heart rate. Vasoconstriction to other areas. I.e., if you're short of oxygen, you're going to start shutting down the oxygen flow to the periphery, to the kidneys, because the brain gets it. If the brain's short of oxygen, the other organs will shut down to get the oxygen to the brain. Baroreceptors, blood pressure. Part of that would be if your blood pressure is low, your blood volume is low, the baroreceptors would cause the pituitary to release antidiuretic hormone. The antidiuretic hormone would cause you to retain more water, less urine, pushing your blood pressure up, pushing your blood volume up. Heart, atrial stretchers, your stretch receptors. that's where you have too much. So the release of antidiuretic hormone is cut down, so you urinate more, your blood volume drops, and you don't have as much stretch or as much pressure on the heart. Your blood pressure goes down. The GI tract, the stretch receptors, when they're full, you get stretch receptors, you get satiety, you're not eating more. It also tells, like in the stomach, to release more pepsin, and the duodenum to release more biliary fluids to help digestion. These are all autonomic reflexes. You can't control them. Summary of the functions, we've seen this one before. We are through chapter 9.
We can do cutaneous receptors and referred pain, and then the ears, hearing and eating.
So we are doing sensory next week.
Yeah.
This week, Thursday. But it's actually kind of a...
It's chapter 9 and, lab 9 and 10.
What's that?
It says it's 2 lab. We're doing lab 9 and lab 10.
Yeah.
Hopefully it doesn't take twice.
What?
I hope it doesn't take twice as long.
They're fast. They're fast. So we will see you all on Thursday.